Okay, so there are a number of different factors that affect our case rate. We have always had a very low rate of infection, which actually means that when more virus is circulating, we've got a lower immunity base. So we would expect our numbers to start picking up. We also then had some issues in terms of the Immensa lab, which I'm sure many of you will remember, where actually PCR tests, people were being told they were negative, and sometimes that was false. So we had infection actually going out into the community and seeding new infections where people didn't think that they had to self-isolate. And then of course we've had schools coming back after the summer holidays and again since half term, and we've seen that that's really where the majority of our cases are. It's in those 5 to 14-year-olds where we see less severe illness, but what we then see is those cases passing the infection on to their parents and then possibly their grandparents. So again, really important to remember that if you've got someone in your household who is positive for COVID-19, there are simple precautionary things you can do to really minimise the risk of you contracting the virus. And again, we're back to that hand hygiene, face covering, isolating where appropriate, and always making sure you're coming forward for your vaccination when you're asked.
There are lots of things that our local communities have been doing to support the pressures on their local hospitals, and I would like to thank people on behalf of all of our colleagues across the 3 hospitals for people's patience and commitment to helping us. Clearly, our ask is a continued ask around making sure that individuals who are eligible for their vaccination, whether that be their vaccination 1 and 2 or the booster vaccination, take up the offer of that vaccination as quickly as possible. It really hasn't ever been more important in terms of this latest news about new variants. It's just a really good reminder that whilst we've been able to enjoy getting back to some of the things in life and some of the freedoms that we've had previously, that we still have an opportunity to minimise the impact that COVID has on individuals in our communities. The other ask is now mandated that we go back to wearing face masks when we're on public transport and in public spaces such as shops, and I would urge people in our communities to follow that guidance and minimise the risks to yourself and to other people. And certainly for us in hospitals, we've maintained that anyway. So people who visit our hospitals or our patients will know that we've never removed the need to wear face masks because we're hospitals that have lots of vulnerable people in them, and we've been trying our best to protect. So I think it's the things around vaccination. Please go and get your vaccinations. Wear the face masks as now is mandated again, and the hand hygiene and measures that we've all got used to actually over the last 18 months to 2 years. And I know it's hard, but we would be really grateful for people continuing to do that. The other reminder I'd like to give is that it's also the season for other infections. So people who are eligible will be offered their chance to get their flu jab, and we would really encourage and urge people who are eligible to get flu jabs to make sure that you get protected against flu as well, because whilst we're focused on COVID, it's not the only infection that can make people feel really unwell at this time of year.
Yeah, so I think we probably do expect case numbers to increase. We know that over the Christmas period, families and friends tend to gather more, and obviously with the weather becoming colder, people are tending to gather more inside, and we know it's in those indoors, poorly ventilated areas that actually the virus transmits more easily. So really the messaging from me is if you do need to meet up with friends and family, which you absolutely should, it's very good for our well-being, but let's do it safely. So have an LFD test before you go if you have no symptoms, just to make sure that you're not infected but without symptoms. If you do have any symptoms at all, you must self-isolate and take a PCR test as soon as possible. And when you are meeting up with people, if you can do it outdoors, that's a great first step. If not, and it needs to be inside, let's keep those indoor areas well ventilated. Christmas jumpers are notorious for keeping us far too hot, so actually there's a really good reason for wearing your Christmas jumper so we can keep places well ventilated. And of course it's back to those usual things of good hand hygiene, face coverings if you're mixing with people you don't normally do in an indoor busy setting, and just really being mindful about what actions you're taking to keep yourself and your loved ones safe leading up to and then during the festive period.
We're often asked whether it's safe to attend a hospital at the moment, and our answer would be yes, it is. So if you're a patient that we've invited in for a procedure or a test or operation that you need, then we are doing everything we can to minimise the risks of COVID in the same way we are in our communities. So we're observing wearing face masks, and we've never stopped that actually in hospitals. We've still got some restrictions in place around spacing between things like chairs in our waiting rooms and some of our communal spaces, and obviously urging everybody to wash hands. But if you need to come into hospital, then it isn't any more unsafe in a hospital from a COVID perspective than it might be in the community. So we would really want to reassure you that it's safe to come in if we invite you to do so. And the same for relatives who are visiting, appreciating that all of the hospitals have still got some restrictions in place around visiting, which tends to be a booked appointment system, just so that we can control the numbers of people that are in the building at any one time and observe those really important measures around social distancing and not having too many people that we're not able to spread at least 1 metre and or in our clinical areas 2 metres apart from each other.